On September 1st, 1900, the Austrian Journal of Medicine published an article that would detonate across medicine and popular culture, marking the birth of a whole new therapy in plastic surgery. Written by Dr. Robert Gersuni, the paper described the use of paraffin injections to treat a range of deformities, sparking a treatment fad that would result in the first filler disaster in cosmetic medicine. Among the patients treated by Dr. Gersuni was a 16-year-old female with a saddle nose deformity. Gersuni injected a small amount of paraffin, miraculously restoring her nasal bridge. This was the first time an injectable prosthesis had worked. There were no immediate reactions, and the implant remained stable in its position. It was, by any standard, a major discovery. The idea spread instantly. In the press, it was hailed as a cure for deformities. In the journals, it went viral. Surgeons began injecting paraffin for everything: urinary incontinence, bladder prolapse, inguinal hernias, atrophic rhinitis, and many other conditions. Then came the cosmetic uses with even more applications: saddle noses, frown lines, ear deformities, receded chins, breast defects. The cosmetic uses of paraffin appeared endless. Tens of thousands of patients were treated within just a few years, with the profession embracing it as if the absence of early complications proved safety. But the problems appeared almost as quickly as the hype. Within months, the first pulmonary embolus from paraffin injection was reported by famed surgeon Dr. Hermann Pfannenstiel. Then another. Then a fatal one. Then came the ocular catastrophes. Cases of sudden complete blindness appeared every few months. Surgeons were baffled as to the mechanism. It wasn't until 1905 that Dr. Anton Elschnig first proposed that the paraffin was traveling back through nasal arteries to occlude the ophthalmic circulation, causing irreversible retinal injury. But even then, little could be done to treat these complications, leaving patients permanently disabled. To make matters worse, numerous reports began to appear, describing delayed inflammatory reactions known as paraffinomas, causing facial disfigurement. The literature that 6 months earlier was celebratory turned cautionary, then alarmed. The collapse of confidence was sealed in the popular press with the disfigurement of Gladys Deacon, the eventual Duchess of Marlborough, widely regarded as a beauty icon. She underwent paraffin injections in 1902 at the age of 21, and over the following years developed granulomas that permanently altered her face. Her injury carried the story out of medical journals and into national headlines. Paraffin was adopted globally with zeal, without trials, without regulation, without skepticism, and the price was blindness, necrosis, and disfigurement. The disaster was not caused by paraffin alone. It was caused by the lack of proper safety regulations that today form the basis for approval of drugs and devices. As medical science continues to innovate, we must ensure that products are thoroughly evaluated prior to use, remembering the lessons first learned over a century ago by the pioneers of plastic surgery. To learn more about this story, visit Pioneers of Plastic Surgery on Substack.